Okay. Thank you guys for coming. I've never done this. I feel like I should moonwalk when I have this in my hand, but I can guarantee you don't want to see that. Right? So I will do my best to keep under control here. Thank you for coming for this. I mean, yeah, we're just going to kind of do what we did last year a little bit, and hopefully you guys will participate, ask us questions as we go, please. Tell us to repeat that or whatever. What we thought we would do is take a little bit of last year's review just to kind of get it into your mind of what we look for in calving, where you might run into problems. And I'm going to go over, or Curtis is going to go over that guideline with you again to get it into your mind before you start. How many of you are calving right now? Should be starting about now, right? Perfect timing. So we're going to, I'm going to ask you, we're going to ask questions to you guys as well. And we're going to go through all this. Then we're going to add, we're just going to review very briefly kind of and go fast. And then we're going to talk about, so once the calf hits the ground, remember this is Homer. He will be doing your illustration again. And once Homer hits the ground, is there things that you could be doing as ranchers to not only do survivability of Homer when he hits the ground, but what about looking into his future? How is he going to perform as a bull? How is he going to perform as a steer? Okay, in the feedlot, how will he grade in the feedlot? Okay, what will be yield grade and carcass grade or whatever? Can we actually change that, add to that at the time of birth? Yes. And then what happens if a female? What will take that female and tell you, maybe I'm not going to keep her because her chance of breed back because of what she went through in her first week of life is probably not going to be good. So those are kind of the things that we want to help you start doing heifer selection, bull selection in the first few days of life as well. And then if we have any time at the end, you're always totally 100% open to ask any PAP questions or anything, because you'll just see me over in the corners yelling PAP, PAP, because that's all I really know. So feel free to ask those anything, and we'll try to talk about that at the end. So Curtis has a slideshow. We're just going to start it off, and I'll hand it to them, and we'll just kind of play this by ear. So please interrupt us anytime.
Yeah, especially when I'm talking. So little bit of anatomy. Lots of times you're sticking your arm inside that cow, and what in the world am I feeling, right? So we're going to start off here with just a little bit of basic anatomy. We've cut Homer's mama in half so that we're able to see the back half of the cow. Obviously, here's your tail. The vulva is going to be right here, and then you're into the birth canal. If you notice this right here, that's the pelvis, and that's your landmark. That's your big landmark. You're going to feel it hard on the bottom of the birth canal as you're going in. Typically, as you just get past the end of the pelvis, then you're going to pick up the cervix. Now, if you're really in the middle of calving, that cervix is going to be wide open, and you're going to slip through it and not even know it's there. But if she's having some problems correctly dilating, you're going to run into that cervix and feel that hard tissue right there. Sometimes as a ring, sometimes as a complete closure that says, hey, she's not dilating yet. Then you actually get into the uterus itself. Obviously, in the pregnant cow, that's much, much bigger than what you're seeing there. Looking at the cow from the back, this isn't perverted, but when I ask you, is she dilated, I'm not talking about the vulva. I'm talking about the cervix that's inside. So that means you will have needed, nod? You should have. Stuck your arm in there and felt and seen if that cervix is opened up so that the calf's ready to come through. So that's what that's about. Calf anatomy.
So it came to my mind when he was talking, I have a question. And so just going back, because it's really important to remember what initiates birthing process. Do you remember what starts that? Because Curtis is talking about cervical dilation, right? What makes the whole birthing process happen if you're a guinea pig, a cow, or a human? Does anybody remember? Dystocia is when they can't come out. So yeah, you're right on track. You're a step ahead of us. Yes. Hormones. Exactly. What stimulates the hormones? Yeah. So see, that's why I'm just really quick telling you is that when that calf is in there, when Homer's cooking and he gets to the 9 months gestation period or whatever your calving is, when that calf picks up in that body that they are now hypoxic, and I love that word, I just like to go home and say it, because that's how I live, right? When their oxygen level gets too low in the uterus, where they are so big that mother can no longer supply them oxygen through the placenta, the baby gets stressed. Just like if I came in, we can do this if you want. I will hold Frank's nose off, and we'll just sit there and hold till he can't breathe anymore and watch him panic, right? And that's what this baby's going to do is when the oxygen level gets low, that baby panics and it sends out cortisol. That's our stress response. And the cortisol is actually absorbed by mom. And then all the hormones start to kick in gear. And then everything starts to happen from there. So just keep thinking that. And why is that important? What happens if you have disease and the placenta gets diseased and then the oxygen can't transfer, right? That's your abortion. So that hypoxic stress or fetal stress or cortisol level initiates that. Sorry, I just threw that out.
All right, if you're going to go down that road. We can also stress mom. And unfortunately, that's a side effect that's sometimes running them through to vaccinate, scour vaccine or something like that. The stress, especially if you're not into low-stress cattle handling, but into high-stress cattle handling, you're going to raise her own natural cortisols. We also can induce labor with cortisols. Dexamethasone is commonly used, so you got to be careful using dexamethasone around pregnant cows. All right, moving on. Calf anatomy. Yeah, you guys know what this means, right? Where I wanted to point out here is how do I know if when I'm feeling in there, am I feeling a front foot or a back foot? Because I can't see which position this little guy's in. So just remember and think about it because it's obvious to you once you see it. On the front leg, you got your hoof, you got your fetlock. Some people call that the ankle. And then you got the knee. And they all bend in the same direction. Okay, so you grab hold of the foot, grab hold of the fetlock, see which way it bends, work your way on up, see which way the next joint bends. If it bends the same direction, I got a front foot. However, on the back leg, it bends the opposite direction. The hock will bend in opposite direction. So if you feel a foot, the ankle, they bend one way, you go on up, the next joint you feel, and you'll be surprised because it is hard to tell the difference between an elbow and a hock. If it bends the other direction, you got a hind leg. So next, you want to make sure that if you got two legs, they're both front legs or both hind legs. Okay, but that's what's important about that one. That's your normal presentation. Now Homer's mom is pregnant. She's ready to have him. Calf is sitting down in here. The feet, the forefeet are coming up into the birth canal, and the head sitting between the two forefeet about knee position. Thank you, Vanna. I appreciate that. All right. That makes sense to you. There's another normal position. Believe it or not, a breech or a backwards calf where the hind legs are up is considered a normal position. Now, the difference between that and a breech is the hind legs are going to be pushed where just the tail's coming. And that little puppy ain't coming out. He's like a cork in a bottle there. That is not a normal presentation. But this one is. And it can certainly be, you can certainly work with that one. All right, the term cow, most of you guys already know about this. You're walking around through the field. Which one's going to go, which one's not. As we get closer and closer, the vulva gets bigger and bigger, floppier and floppier. The ligaments, you can't really see them, but going from the pins up to the hooks start to soften, and they start to sink in right there. Obviously, you should see some udder development, and that's a good sign that you're getting ready to consider going through there. And so Tim already went through the hormones, and then we're getting ready to start the 3 stages of labor. You want to cover the 3 stages of labor?
Do we have them one at a time? I think when you're going through this, the most important one to me, they're all important, right? But stage 1 is when the baby is initiated the panic mode, right? We'll just call it the Frank from now on, because we're going to start to panic and everything's going to go awry. The hormones are going to drop. Frank's panicking. Everything's going to happen. that is when you first start to see stage 1, okay? So what stage 1 is, that baby is getting active and he's trying to get out. He's going to get up and he's going to put his nose into the cervix and push on that. So the things that you see with that is that it starts to be painful as the cervix is dilating. That cow's going to walk off by herself. She's going to wring her tail. She's going to lay down, get back up. Sometimes you'll see her eating. Sometimes you won't. But you know what's happening. There's abnormal behavior happening because there's a pain threshold there, right? And the whole purpose of that is when that cervix is starting to dilate like this, that is the painful response, right? So I'm going to show you something that is key to remember, okay? So that all happens, and I like them as an average time of, we put up here 2 to 6 hours, but in a cow, that's an hour to 2 hours. If you have a cow and you're watching her and you're stage 1 and she's acting weird, goes 2 hours, I'm already getting nervous, right? I'm a nervous person anyway. If in a cow it goes 4 hours, I'm done. I'm 2 hours behind now, okay? And that's why we put this here is up to 2 hours. That baby, you should be into stage 2 by that time. So if you're not, something's gone awry, okay? So now I want to show you what I see that goes awry all the time with cows and with heifers that stop that. So, can you bring that one up? Let's just picture something for a minute. Because if this baby's coming like this and we have the breech and the cervix is here, bonk, the butt sticks in the cervix. So there's no ability for the cervix to dilate anymore. Does that make sense? So the baby can't get through. He gets exhausted pushing, falls back in. That's why when we get to go out and do breaches, we're about 2 or 3 or 4 hours behind. Because what will happen is, what's supposed to happen is this. The nose comes in, pushes through the cervix open, and out comes the baby. Out comes Homer. But remember, if the cervix isn't dilated because of a breach, then the cervix never is going to dilate. So stage 1 is going to go, it's going to be prolonged, but then what happens is it stops. So people, I'll get the call, can cows have false pregnancies? Because I thought she was in stage 1 or active, and now she's over at the bunk eating and acting like nothing happened. That does not happen in bovine. Yes. Yes. If the back legs are coming out and the butt's coming out too, like just a plain backwards calf, that cervix will usually dilate. You may have to help it a touch, but it will start to dilate. So one thing that I see that's missed all the time that tends to be a wreck in the dairy industry is this right here. And this is still stage 1, and then I'll pass it. So we have the baby. Look, I'm going to talk to you too. Sometimes I get confused on where I'm at. So, Lord, so I've got the baby in here like this. And what have any of you seen a uterine torsion or ever heard of that? So it's when mother rolls or something like that and the cervix is here and the baby turns like this and the uterus turns, and so there's actually a tight knot right here, and so there's no way the baby can get out. Here's the thing that I hear about that. This cow went into stage 1, and we're out. I mean, she pushed it, and she looked at it. She actually saw her pushing, but now she's acting normal. I said, how long ago? Oh, that was 3 or 4 days ago. And she's still acting normal. And she will go 2 weeks and act normal. And she might even go 3 weeks and act normal, and then she's going to die. Does that make sense? So that's how I want you to stick to those rules that Curtis and I were talking about, because if stage 1 is going too long, something's awry. Okay? So it's I go 1 to 2 hours in cows, and I'll go 2 hours in a heifer, and then I'm going to do something. Okay? Did that all make sense? Stage 1. Okay.
Okay. Now we're into stage 2. Makes sense, doesn't it? It's logical. Stage 1, stage 2. I like it. Technically, that starts whenever you see either a water bag, you see this balloon sticking out there, or some part of the calf that starts to show beyond the vulva. That's the start of stage 2. Write it down in your calving book or something like that, because you guys got a lot of stuff to do. You won't remember to know, well, has she been at it for an hour or is it 2 hours? Okay? Because we're going to want to get through this part in a relative and see some good progression. Now, backing up just a second, there's other things that can poke out back there. And it's not necessarily just a water bag. So I wanted to give you Let's go back here. Whoops, wrong one. All right, you see this one is translucent. It's watery. It's real soft. It's like a water balloon filled with water. Now we're going to go the wrong way. Okay, so this is what we call a cervical prolapse. The anus is up here underneath the tail, but you got this big fleshy volleyball to basketball size thing sticking out there. That's what we call a vaginal prolapse. She hasn't calved yet. The cervix is typically still closed, but because the ligaments and the things that hold that cervix in place have weakened in some cattle, it's a characteristic of Herefords. Then when that cow lays down and that calf is pushed up by the dirt, then a little bit of that vagina will stick back out through there, and you'll see this little bulge between the vulvar lips. And then she gets up and goes back in. And then as she goes further along and she lays down, that little bit of vagina that sticks out there gets a little bit of sunburn, a little bit of windburn, and now she starts straining and she starts popping it out like this. If you can get it back in, that's great, but if you leave it out for a long period of time, it becomes weathered and very hard to get that son of a gun back in there. And so we have to push him back in and do some sort of a procedure to get it to stay in place that she can calve down the road. If you have a cow like this, you do not want to keep her. She's going to do it again the next time, and she's going to do it earlier within the pregnancy, and it's going to be a total wreck. It's probably not a good idea to keep her offspring either. Now, the other thing that we can get is what they call a rectal prolapse. This cow, her vulva's down here. This is the rectum sticking out. She's been straining for some reason or the other, and she's actually prolapsed part of her rectum. And that doesn't look pleasant to me either. So, on the other hand, after they've already calved, they can throw the whole womb, what they call a uterine prolapse. And what you want to notice here is how far this thing can come down. It can come down clear to the hocks, or if they're really bad, they'll even be dragging on the ground. But you'll see how big and fleshy this is. There'll be these big red cotyledons, we call them, or buttons, old timers call them, sticking out there. This is a true emergency that needs to be cared for right away, and you need to figure out where that calf is, because he ain't inside of her anymore. He's out there somewhere. All right, this is stage 2 again. This is where we're going to get the little guy out. So remember, you see a little piece of the calf sticking out. You see a water bag. What do? Write the time down. Yeah. This is where she's going to be really pushing and really getting after it. And you should be seeing some rapid progression of things as we go through this. Restlessness, pushing, she's going to go down. That calf, once he enters the birth canal itself, that stimulates some very strong contractions. So many times they'll sit there and strain for 1 to 3 minutes, and then maybe they'll relax for a little while for 2 to 4 minutes. And then they're back at it again. But the whole time, you should be seeing something happening, something getting a little bit further along, a little bit further along, a little bit further along, because if it's not, then we may have a problem with the presentation of the calf where he's not going to come out without some manipulations. Oh, that's what I said. Okay. Once a calf gets to this point, he'll actually try to start breathing. And so if a cow spends a lot of time at this spot and the fetal membranes are still over the calf, that's where some of your stillborns are coming from. He's suffocating because she didn't get the fetal membranes off this little amniotic sac here. All right, heifers should do this all within 1 to 2 hours, a cow within a half an hour to 1 hour. Well, from the time you start seeing either the sac or a part of the calf, that calf should be on the ground. If not, if things aren't progressing, it's time to get her up and check her and see what's going on in there. Rarely survive in stage 2 longer than 8 hours. It really goes downhill after 2 hours for a cow and a heifer both. This is Tim's favorite one.
So one thing to put emphasis on, what Curtis was talking about stage 2 being 2 hours, keep thinking in your head, that is 2 hours until the calf is on the ground and getting up, right? So if you're having a problem, in other words, you got a 2-hour time limit, but that's 2 hours for the calf to be on the ground and getting up. So you don't want to wait 2 hours and then go, okay, I better go get her, because by the time you get the calf out or manipulate, you're out 3 hours. Okay, now your breeding potential is dropping in a hurry. Does that make sense? So act before, don't wait, act before, if that makes any sense. This is one of my, if you remember last year, this one drives me batty, right? You got to be on the alert when nest comes out, when the placenta's out. It doesn't matter what's happening in your life at that period of time. You got to drop everything you got, go and get that and drag it off and hide it somewhere or get rid of it. So I was telling Curtis this morning when we were meeting 2 weeks ago, I had a heifer that delivered. We calved a little early up in Fort Collins, and they let her eat it and didn't think anything about it. So about 2 weeks later, they called and said that heifer they calved is not doing well. And so I go out and found she's her rumen is hard as a rock. She's all bloated up and everything like that. So we tried a few things. I did not know about the placenta yet. But we tried a few things, actually ended up having to euthanize the animal. And on necropsy, I found the placenta in the omasum. So she had eaten it and it plugged everything up and it killed the cow. And how many have I seen kill cows? Numerous. Most of the ones I see are just like that, and it gets over their trachea and they can't breathe and they suffocate. So you got to pick it up. And if it's hanging out more than 12 hours, once you hit 12 hours, it's called retained, right? So you need to be doing something at that point. If you're out 2 or 3 days, remember every day that it's out is equivalent to about a day later that they will come into heat. So if you're out 2 weeks or a week, you're going to miss your whole first cycle easily. Okay, so this retained placenta is really correlated with when they're going to come back into heat. If you're trying to get them back into heat in 42 days, you better have that out in 12 hours easily. Does that make sense? Questions on that? So yeah, so if they're out, so after 12 hours, if you go in another day or another day, it's going to be that equivalent to another day that they're going to cycle. And so, but once you hit a week out, then you're going to actually miss your first cycle. Does that make sense? Which is really, really important if you're on a time 42-day breed period and you need that time frame. Okay? Yeah, so what causes retained placenta? The list is enormous, and we can sit up here and make things up and we'll be right? The big ones that make things up are any kind of a dystocia because they didn't separate how they were supposed to, back to the hormones. Okay, so if you have to pull one or anything, you have a good chance of retained placenta because something's not working right. They're low in prostaglandins, vitamin A deficiency, vitamin E, vitamin D, too low of carbohydrate, too high of carbohydrate, pine needles, diet, infection, those are all potentials, and genetics. Anything I missed on that? Oh, that's a, yeah, it's paradise to me. I love the things. And if they've been out 2 weeks, I'm even happier. I don't know why, but we all as veterinarians get excited over things. And Matt, even seeing that picture, I'm about to have a seizure. Because I just want that thing so bad. So I think the way you got to get them out, you have to go back to your drugs, right? You got to get them out with drugs because I go back to Ludulase, okay, which is, we all use that. Not us, but we use it on our cattle. And so I use Ludulase and I use oxytocin. And then I tell you, if it's been out more than a couple days, I start flushing the uterus. Then I'll flush it with 1% betadine and saline. And I'll just go in and try to flush it because the saline itself helps. I put antibiotics in there. I put Oxy-10 in there to flush it and clean out all the bacteria that are growing. And I will actually flush them every day on systemic antibiotics, and I'll use my drugs here until I get it out. You never want to go in and like pull them, but I flush it, I lift gently, and I'll massage them. So I flush the uterus out as I'm trying to get them out. What's that? We'll breed by the time if I'm there or Curtis is there, your breed back on that cow is you're probably going to call her open the next year. She's probably not going to breed back. That's why get after it early and see where you go. If you don't have a breed period, then you're probably going to be fine, but she's going to miss 2 cycles. Yeah. They do not help with retained placenta very much, but they will help with the infection that's following, okay? Yep. And I shouldn't say they won't help with the retained placenta. They're just not one of the drugs I'd go after right away. I do use them. Okay. Question?
Do you think that this is a learned behavior to hide the smell and blood from predators, or?
Yeah, that's exactly what it is. It is if I have the choice for something to eat Homer or eat the placenta, I'm probably gonna. If it was me, I'd probably let him have Homer. But if it's a cow, they're gonna eat the placenta, hide the scent. It's interesting. I told Curtis today, there's nothing I want more in my life than to see an elk digging a hole and burying the placenta and kicking dirt on it, because then I know my theory is correct.
So as you're working with it, get as much out as you can with gentle traction and stuff, and leave it hanging. Don't cut it off. That weight hanging out there is actually going to help separate it. Old timers would sometimes take a burlap sack and wrap up in there and wet it down just for that extra weight. So that's just something to throw out at you. Kind of went through a lot of this already for you. Stage 1, longer than 6 hours. Go in and check, see how come that little guy's not coming out. Is he breached? Is the cervix not dilated? Or do we have a torsion? Do things not feel right? Cow's been pushing. You think she's acting like she's in stage 2. She's really pushing, but nothing's showing. Something ain't right. If you start getting bloody vaginal or rectal discharge, she is pushing so hard that she's actually rupturing vessels, and that needs that. Look in there, see why she's doing it. Resting more than pushing. And then, like he said, if she's been moving right along and then all of a sudden she quits and starts acting normal, something ain't right. And in about 2 or 3 days later, there's going to be an odor back there, and you're going to know why. There's something ain't right. Over an hour passes from first seeing water sac or parts of the fetus without significant progress. Again, remember, you want that calf on the ground within 2 hours. Get an early start on it. And then if the head's coming, and it's something, and it's swollen. If the head's swollen, if the tongue's swollen, this cow needs some help. And then obviously, if we're only seeing 1 foot and a head, something ain't right. Pardon? So you're talking it's already partially dilated? Yeah.
So, yeah.
Lisa.
Yeah. You need to be the pelvis girl.
And then start working them apart. So it's one of those funky exercises that they used to do. They increase the size of your bust. Okay, so believe me, it works. So you're going in, you're getting your hands in there as far as you can, and then you're widening them up. You're stretching them, and so you take it in there. You go in there, and for 10, 20 seconds, gently push. Rotate a little bit, do the same thing, and keep working around. Now, if it's bigger than what you can do that way, many times the head's up there or part of the body's up there, you can get your hand between the cervix and that part of the body and kind of lever it that way.
Not as easy as he makes it look, right? It's exhausting. So one thing I just wanted to add on the tongue, if you're seeing the tongue swollen, you know you're way behind. The tongue is actually the last organ in the body that will swell. So if your tongue is swollen, your heart is swollen, your lungs have got pulmonary edema, your kidneys are swollen, you have intestinal edema already. So that calf is going to go into the next part of this talk, and it's going to be a calf that needs special attention. Okay, really important. It's great to stick it back in there and go, oh, it'll go down in time. But remember, that's the last organ that swells, so that calf's going to really, really need your neonatal care that we're about to talk about. Does that make sense? Okay. Oh, is it my turn?
Yeah.
So if you're going to do this and you're going to go in and all this is here, one of the big things that we need to do is, okay, your time limit's up. Stage 2 is now at 45 minutes in your cow. That's too long. I'm going to go in there. The biggest thing to remember that we're going to wash her and clean her up, right? I mean, she's got poop everywhere. She's laying. So I wash them really good with betadine solution. I wash myself. I put on gloves if I want. Unfortunately or fortunately, I usually don't wear gloves, but I scrub my arms because I can't feel things. And then I lost a glove in a cow once and was mortified. So I mean, I shouldn't tell you that as a veterinarian. I didn't lose it. I put it in there. But I just wash my arms really well. And then the biggest secret of this is lubrication, right? So if you think that when you're pulling and you know that it's going to come out because you followed criteria that we'll talk about briefly, I lube them up. Okay. You cannot use too much lube, right? If you're not falling down, slipping, you're not using enough lube. So my favorite is J-Lube, but I only use this if I know that I can pull that calf. Once you use that, it makes your C-section survivability go way down, okay? Because if you open the uterus to get the calf out and you have J-Lube in there and the J-Lube gets into the abdomen of a cow, which it will because you're opening the uterus, it can cause a pretty severe reaction and they'll get adhesions and some, I mean, I've had them live before, but it can take a long time to heal from J-Lube. So my favorite before that is just OB lube that you buy over the store. You can use Crisco. I've had people use butter, bacon grease, anything that's going to help. It doesn't matter. But use something that's pretty clean or pretty sterile and lube the thing up. And I like to actually take a tube and put into the vagina up over the calf, and I lube his hips up as well, all the way in. So when I start pulling it, you want it so if you're back there pulling it and she coughs, it flies out and knocks you down. That's your goal of lube, okay?
All right. Make sure the cervix is dilated. Check your position, or your presentation, excuse me. So what do we want to see? We want 2 feet. I'm sorry, you guys running the sound back there. A little bit further back, the head should be resting on the feet. How do you know if it's a front foot? They've been the same. Joints all the joints been the same way. All right. So presentation's good. Position's good. Now it's time to see if we can get this little puppy out. All right. When do you call for help? If you can't figure out what's going on, don't be afraid to call for help. All right? If the calf is upside down, now, if he's coming backwards, those feet are going to look like he's upside down. But how do you know it's a back foot? Remember how the hock bends different, right? All right. So as you're starting to pull on him and do some tension on that calf as he's coming out, if you're going to be able to pull it, you should be able to get both fetlocks, both ankles, about 5 inches beyond the vulva. That's about a hand's breadth. Okay? So if here's the vulva right here, I should be able to get a hand's breadth between the fetlocks and the vulva. At that point, the shoulder should be engaging into the birth canal. Make sure the head's still coming, because sometimes that head will slip off, but make sure the head's coming. If you can do that, there's a really good chance you can go ahead and pull that calf safely. If he's coming backwards, you should be able to get the hocks to the vulva just by pulling by hand. One to 3 people pulling by hand should be able to accomplish that. This, you haven't got to the calf puller yet. You haven't got to the Ford. You haven't got to the John Deere. This is just by hand. And certainly not the calf puller. All right. Now, if you're feeling around in there, he's presented wrong, he's got a foot back, he's got a head back, and you just can't make any progress within 20 minutes, stop. Go ahead and get some help. Once you start going much beyond 30 minutes, you're really reducing the chance of that calf surviving and living and being productive. And then again, it's going to extend your breed back. If you're going to have a C-section, the earlier it's done within the procedure, the better off we are. The better the chance for the dam, the better the chance for the offspring. Okay, so the umbilical cord, if you remember, it's in the center of the belly. And as long as that center of that belly is inside the womb and the placenta is still attached, then he's still getting blood, he's still getting oxygen, he's still getting these nutrients. The minute that umbilical area gets up over the brim of the pelvis, remember that thing that you're feeling on the bottom? It's going to pinch it off. And then that calf's going to need to switch to breathing normally within 4 to 6 minutes, or he's going to die. So if he's coming backwards, when do you need to get that head out? Fast. Okay? You like playing with the tail?
And once you see the tail, you know that if the tail is out and you can see it, the umbilical's pinched off.
There you go.
So once you see the tail, you better start pulling.
Now, if you're coming the other direction, usually the chest is out by the time that the umbilical cord's pinched off, and the calf will actually start breathing on its own. Okay? And so you got coming forward, you got lots of time to fart around and play. And it's not a bad idea if you're pulling on one that when he reaches that stage right there, to actually stop a minute and give him a chance to breathe. Because if you've got the pullers on him and you're really stretching him out, he cannot breathe. And then if you hit a hip lock where you can't get him out, you're going to suffocate the poor guy. Make sense? All right. So these are things that tell you, hey, it's time for me to go get some help. Calf presentations, like we said, you got your normal anterior presentation, the one on the left. You got your backward presentation. They're normal. There's all sorts of weird things that can happen inside. We're not going to cover them too much today because we wanted to cover some other things. But these are some of the weird ones. This is your true breech right here. And it's a bear to get those little guys back up and then coming out the birth canal. And that one, you never know, do I got one calf or do I got two calves? You guys run into this lots of times with goats and lambs. All right, the calving chains.
So these are really important, and actually we'll hook it on. I can hook it on Curtis or whatever, but it's important that you take your time in doing this, right? That you do it. So he's hooking it on. And notice so here is Curtis's fetlock. So I'm going to work until I can get it. So he's coming out head first like that. He's working until he can get it like this above the fetlock, and then he's going to half hitch it. I don't know if I could do that with one hand. Like that. And it's going to come down below the fetlock, and it's going to lock like that. So when I pull on him, see how it's pulling straight? I'm not going to break the leg with that. I can pull pretty hard with that. And do nothing. If I take the half hitch out and I pull, see what it does? And that's how you break them. So sometimes you remember you got to get it out 5 inches anyway, or a hand's breadth like Curtis was talking about. So if you can't get the half hitch on, you need to try a little bit harder or decide it's not going to come out of there. Is that right? I mean, I know you guys put the chains on, but now hopefully you'll understand if I can't get it, stop and work until I can get it. Does that make sense? Okay. Perfect. All right. Here, let me dechain you.
All right, so that's chains. We like using chains. They're easy to sterilize, and so you're not transferring disease from one cow to another. Obviously, you can use ropes. You can use baler twine. You can use straps of some sort, whichever works for you. We're going from place to place to place. We don't want to carry disease from other places. The other thing that comes really handy with chains is a handle. And with these handles, they've got this neat little hook at the end. The one thing I want to remind you or warn you of is these are not the best things as far as holding, okay? So they will slip on you. They will pop. And so when I'm putting them on, I try to use the very end like this. But if I got a long chain, I need you to hold that. If I've got a long chain, I'll actually put a knot in it so that thing won't slip, because I have busted my head on many a post when that thing released on me. So just a little something to tell you about. I like having both a long chain and a short chain. The long chain gives me a little more length family in there to bring something up if I can reach it. Whatever works for you, but I like having one of both. Yeah. All right, we've already went through that. What position you want the cow in? Right side down. Somebody read the notes. Right side down if she's lying down, or it can be done standing. If you're trying to correct a malpresentation, it's easier when they're standing and the calf's over the edge. You got a little more room to work with. Once you start pulling them, it's nice for her to be laying down and have her guts helping you push that guy up into position. You're less likely to hip lock if they're laying down. Again, both fetlocks, if you can get them a hand's breadth beyond the vulva, you can probably pull them. And that's just with one person or one to three people pulling. That'll equilibrate to about 400 pounds, 400 to 600 pounds. You usually won't break a calf leg with that. If you go right straight to a calf puller can generate over 2,000 pounds. It's real easy to break a leg. Really. The way the stomach lies on the left, it'll kind of help push the calf up as she's laying on her right. That rumen is this big 50-gallon vat in there, and if you have him laying on the right side, instead of the calf laying on top of it, he's underneath it, and it kind of helps push it up. All right. Then we already went through that one too. Now, how do you want to pull? One leg at a time. You want to walk them through the pelvis and give the birth canal a little bit of chance to halfway dilate, fully dilate, halfway dilate, fully dilate. That's how you want to work them through. So Tim will show you here.
When we hook on, when they're coming forward, and I always think, even to this day, when I see the forward, I'm going to make him walk out, okay? And I'm going to pull and walk. Wait, then I'm going to pull and walk, and he's just going to start walking towards me. I'm going to pull, walk, and I will do that all the way out, okay? And that's just what I do. Yep, I think that's best to just leave it at this. So when they're coming forward, just keep thinking I'm going to make him walk out like this or crawl out, okay?
All right, now start thinking a little bit of geometry. The cow's pelvis is not totally round. It's oval, okay? It's longer from top to bottom than it is from side to side. Now, when a calf's coming normally, which way is he the tallest? Which way is he the widest? Through the shoulders and the chest, it's up and down. But when you get to the hips, it's side to side. So, want to show them? As we're bringing this guy through again.
So when I get the legs out like that, and I've got my chains on and everything, before I do anything else, I'm going to put my arms in and I'm going to rotate him at a 45-degree angle like that. Then I'm going to go get the lube that I have, and I'm going to lube it. I'm going to take the tube and go on top, and I'm going to cover him all over with lube on all around it like this, rotated him. And with the back legs, I've got the tail just about out. So I just start pulling back like this. Now the tail's out, so we know the tail's out, so we've lost our oxygen supply. So with him, I'm just going to pull both legs at the same time and make sure he stays at a 45-degree angle. Does that make sense? So on the backwards one, you just pull straight and get them out. Just turn in 45-degree angle so you can use that pelvis. Okay?
So the concept's kind of like trying to take this moose through a door. You want to, or if you're working a head catch and you got a horned bull or something like that, what do you want him to do? Twist their head. And that's the same thing you're doing with this poor little calf, is making sure that that's doing it that way. Again, as far as a hip lock, if you're concerned about that, if they're laying down, that helps a lot. Pulling the cow's legs forward a little bit while she's lying down will help open up that pelvis where there's a little bit more room for you also. Remember, if you're pulling for a normal presentation and the calf gets the chest out and he's able to breathe, relax. You don't have to kill yourself trying to get that guy out too fast. Backwards, different story. But give the little guy a chance to breathe, a little chance to catch up. You don't want him to get oxygen starved. And they can survive a surprisingly long time in the hip lock position. Tim just went through that. All right, calf pullers. All right. Very big caveats with this one. We all use them because many times we're there by ourselves or we just have a little old lady helping us. and I can't pull as strong as she does, so I use my calf puller. Calf must be in the proper position, proper presentation. Those guideline tests, what are they? Where the fetlocks need to be? 5 inches beyond the vulva. Or if they're coming backwards, where do the hocks need to be? At the vulva, right. All right. There's a 600-pound, 2,000-pound. You do the math. You can really tear up a calf. You can certainly screw up a cow. And please, please do not use John Deere. Do not use Ford. Do not use Chevy. Dodge is probably okay. They can't pull that hard. No. If three men cannot pull this calf, then he does not need to come out that way. All right. Now we're getting to the newer part that you guys haven't seen before. Certain things you're going to see about this calf that you really need to pay attention to when he comes out to know you're going to have a problem calf or a potential weak calf or a dummy calf. One is a meconium staining of the hair coat. Meconium is the first poop, right? And if a calf is severely stressed, he becomes anoxic. We've held Frank's breathing nose for too long and he can't breathe. He's going to crap his pants. They crap in the amnion, and that's that color that you'll see on them instead of being the normal colors. If you see that you know that calf's been really badly stressed. If it takes him a long time to stay sternal, stay up on his chest like Homer is, that calf's stressed. If you really slow blink in the eye, if you touch his cornea, touch his eye, he should be just like you. He should blink his eye. If he's slow to doing it, that calf's been stressed. Stick your finger in his mouth and wiggle it a little bit, he should start latching on and wanting to suckle. If he's not doing that, that calf's been stressed. If he's blue, bad sign. Or if you look at the whites of his eyes and you're starting to see some bruising there, that calf's had a hard time. And then obviously if he's got a swollen tongue or head, that calf's been stressed. And this is a calf you need to pay more attention to. Statistics show that 30 to 50% of our loss of calves before weaning happens here in the immediate postnatal period from dystocia, not from diseases, not from scours or stuff, but actually because these calves were severely stressed and we just didn't give them the help they needed. So what are some of the things you're going to run into that's going to cause this stressness? All right. Well, number one, he's been in there a long time. Number two, it's been a hard pull. Number three, we get him out, and what do we do here in the San Luis Valley? We dump him in a snowbank. So they're going to become very cold and chilled very quickly. And all those things can contribute to this calf doing poorly down the road. When we're not breathing, our body goes into a type of metabolism called anaerobic metabolism. And so when that happens, then they build up a certain acid called lactic acid within their system. That makes them acidotic. Acidotic calves are slow, they're dull, they don't do well. They don't absorb their colostrum well. And so we're going to talk about some things you can do to help get through this acidosis, through this lack of oxygen, and try to keep these little boogers warm so they can survive and thrive. Putting them on their chest is a big one.
Go ahead.
Okay. As I grew up, when the calf was pulled, the first thing that people would do was what? Hang them upside down. Why? Well, they got all this fluid in their chest, right? They got all this fluid in their lungs. And so when I pull them out, all those gallons of fluid seem to come out. Actually, that's not fluid from the lungs. That's not fluid from the windpipe. That's fluid from the stomach. The lungs haven't even inflated yet on a lot of these guys, so there's nothing there. And then, so by hanging them upside down, you ever tried to breathe standing upside down? It's not easy. For those lungs to break loose and fully full with air, think about when you blow up a balloon. All right, when you first start and that balloon is so small, how hard do you have to blow? Pretty dang hard, but then once you get it going, it gets easier and easier and easier. Same thing with a lung. Those first few breaths, they're trying to break that seal within there, stretch the tissues, and if you got him hanging upside down, that just adds to the problems. So if you want to hang him upside down, don't do it for more than 2 seconds, but get him on the ground. Tim's setting him up in this sternal position where the chest can open up and fully breathe with minimal effort, even better than laying on their side. On their side, that downside lung is still collapsed. It's still hard for that thing to break open and start breathing. And the first thing we want to do is get these boogers breathing. That's the first part of life.
And so take a look and see how I have his back legs. Really looks uncomfortable, right? And that's exactly what it is. If you put them like this and you put them in a kind of a normal position or something where they're comfortable, that's great too. But I like to make them like this and then get them stand up so they're totally straight up like this, not over inside. I'll even hold them or do whatever, and I'll put the legs underneath them like that because it's uncomfortable for them. So that starts to give them a little bit of pain and a little uncomfortable, and it actually helps their breathing. So I like to set him just like that, and I'm going to keep him. If he starts to tip, I'm getting him back up. Okay? Does that make sense? And sometimes you could even touch them like this and start to help break that open and relax them. Coupage, they pound on them just gently like that to help break those lungs loose and get them going. Okay, so this is another one of my favorite ones because, again, I'm studying oxygen, right? So I like oxygen. How many of you, after last year, went and got oxygen? Yeah, and I know you went and got tanks, right? The little cans? Yep, for your lambs and stuff. I was excited you had done that. You guys went and got one? Okay, you did? So I'm going to re-emphasize this because really the research in this in human babies and everything is astronomical. And we used to just think, well, the oxygen helps them breathe better and gives them oxygen. But we are now learning what this really does to a newborn. And I honestly, I make my own stuff. Like this is actually a real mask. I don't have any of those. All mine are funnels I got at True Value or something because I want to look good. And so I put it on my 92-cent funnel, and I use a funnel for a mask. So all the things that oxygen does, number one, remember they're born with a hole in their heart, okay, and oxygen closes that. So if you live in Alamosa or Monte Vista or San Luis Valley and you're actually above 6,400 feet, your calves are not going to get enough oxygen to close that hole right away. Horses can go out a couple, 3 days and be fine. Cattle are supposed to close within an hour after birth. And remember, the thing that closes those is oxygen. So if you're not getting enough oxygen, which you're not if you live here, you need to supplement to close that hole immediately. If that hole stays open for more than an hour, it is causing permanent heart damage and lung damage. Okay, because remember the left side of the heart's generating a pressure of 146, and the right side of the heart's generating a pressure of 31. So if the left side of the heart is blowing to the right side through that hole that should have closed, you're already starting brisket disease in the action. And if the oxygen is there to get into the system, because testicles and ovaries start to develop immediately, okay? And so what happens to them, they're hypoxic, they do not generate or they do not start to replicate the cells that they're supposed to do. So you're going to get reproduction issues with that. The other big one is immune response. So we're following calves out that had dystocia. It had no oxygen. Were born in high altitude. Same with babies in the human world. We're getting out to the feedlot, not necessarily in the human world. You go to a feedlot, but you might. And so as they go into the feedlot and they didn't have oxygen, but they still survived, remember that the pulmonary immune system starts within seconds after the first breath. So if you starve the pulmonary system of oxygen, you're decreasing the immune system of those lungs. And as that baby grows, they're going to be more prone to respiratory disease and probably die of pneumonia or not do well in the feedlot because of chronic lung disease. So I cannot stress, I'm just going to rub this tank for a minute because I cannot emphasize how important this is, especially living in altitude. And how big of an investment is this? You remember what it cost you? Yeah, $16 and 2 minutes out of your time. Okay, because you don't have to put it on there for 2 hours. But if I have that baby that's flopping over, or I had to touch the baby, or you guys had to touch the baby, then they need oxygen therapy, even if it's for 5 or 10 minutes. Okay, yes, you do need a prescription for this, but your veterinarian here in Monte Vista, I'll try to talk to him, probably can write you a script. Okay, and see, because then you can use oxygen off your acetylene tank. Just don't get confused and pop him with the other one. That's probably easier said than done. So you could use, have I stressed that enough? So if we get to come back again, I want to ask everybody who's got oxygen. Because, I mean, I have it on the lambs that we do, the cows that we do. When I did small animal, I had it for my puppies and kittens. Everybody needs this when they come out. Why do you think human babies come out and they take them right to the oxygen tent? Because they know for babies, it's really important for reproductive status when they get to hit puberty and pulmonary immune system. Okay. Well, we don't know that, but that's why do you think that's you're brilliant. That's exactly what we're chasing. How many of these cattle that are dying in the feedlot are actually had dystocia problems or sickness as a baby calf? And it's pretty it's revealing when you go back and not ear tags that they got feverish or something when they were weaned. This is going all the way back. And I think I told you this in Gunnison when I was there. Any baby that was a dystocia, especially a breech or backwards calf, or anything that got sick within the first week of life and did not get oxygen, we tagged them and they sold them at weaning. You do not take them to the mountain because they can't pass the pap test and they don't come home. Or you go in to preg check them and they're open. So, okay. Oh, yeah. So let's just say that this little guy came out and he's like this, and you look down and he's not breathing. We got the oxygen on him, but you have to breathe to get the oxygen in, and he's not breathing. You can try roughing him up a little bit, still not breathing. I go to this, right? And I am still a fan of acupuncture on this. It is not a myth, even though my mother thought I was the son of the devil when I started this for some reason. I don't know why. Maybe I was, and she didn't tell me. But acupuncture is very, very, very powerful. And you can see they're actually teaching acupuncture in emergency medicine now, and have been for years. And there's a point called GV26, and you can see right here, right below the nostrils. I almost got acupuncture right there. You don't have to have a fancy acupuncture needle. I take any kind of needle that you got, and I try to use 18 gauges. And I'm going to go right. I'll hold the baby and try to keep him sternal, not like this, but get him sternal or hold him like that. And I'm going to take that needle right between his nostrils. And you don't go like this. You're going to go like this. And you want to hear it hitting bone. So when you look at the innervation of the face, it's fascinating to me. I would do it, but then again, I would seize again. So you're going to go right here, and that's where this thing in your nervous system called sympathetic, that's the fight or life or flight for life or whatever. What do you call that? It's the one that makes you breathe. So if you do that really fast like that, it's going to actually cause that animal to inhale. and cardiovascular heart attacks, anything like that. It's a great point to learn, and that's all you do. How long do you do it? I've done it for 2 to 3 minutes before. Oxygen up the nostril, took off my funnel, ran the tube up the nostril, and continued to hit. A drug that I put, can I talk about that too? So a drug that I use, the problem that I hesitate to bring this one back up, but it's a phenomenal drug called Dopram or Doxapram. It's fantastic. It's a respiratory stimulant, so you get a cc of this or 2 cc's of this under the tongue, acupuncture them, and if there's any life left in them, this will bring it out. The reason I hate to share this with you is right now it's really hard to get. I've been trying to get some. Curtis had, I think, 4 or 5 bottles. He now has a half a bottle. And I have 4 new bottles. So it's really a difficult problem to get, but I would search it for it, and if I see it again, I'm going to buy every bottle I have and hoard it. But it is a great product. Even if you go buy 1 syringe full of it, label it, and keep it somewhere near your barn, because 2 mils of this can save an animal with acupuncture. It's Dopram, Dopram. And call Curtis about it and talk to him. Yes. Nope, just squirt it. Yep. And what my boss up at CSU is not a believer in it. He said, yeah, it doesn't work. Well, it's a human product, so they use it in OBs. So I'm going, let's just try it on this calf. It doesn't work. And he went to plunge it, and the syringe was stuck, and he pushed really hard and went, you've all had a syringe blow up on you, right? It went in his mouth and in his eyes, and he backed up, and he's going, I don't think it works. And I will never forget it was a day of paradise for me. You don't have to be academic to believe in things. So, and he would be proud of me for sharing that story. Okay, I'm good.
I can't follow that. Anyway, other things to stimulate breathing, sticking something up the nose, a stick, a piece of straw, jab that nasal septum and really wiggle it around and stuff. Putting your finger in their ear, that tends to make them breathe funny too. Some people will put cold water on their head or something like that. I hate to do that in the San Luis Valley because you're just going to make them colder, right? But these are all things that can be tried to stimulate them to breathe. Sometimes just a good rub down, like he was saying, with a towel or a bunch of straw. When mother is licking on these guys, she's stimulating them, getting them to breathe. All right, so now we got them breathing. We're going to take care of a couple other things. Naval care. You like this one?
I like this one. Okay. So the reason we put this, naval care to me is, again, really important, right? So I try to make it right away, even when I'm putting him sternal and things. So you can buy the cups, right, that have iodine in them, and you put them on like that. The reason that we put this picture up here of this is I've run into a lot of cases, and again, I'm not blaming dairy, but that's what I'm seeing a lot now. But I've seen it in 2 beef herds as well, where they had this. If you have one of those, it works phenomenal. It's a little cup. You put it over the umbilicus. You squeeze it. It squirts the iodine up, falls back in, and you're done. That's great. The problem with it is these are made for one-time use. Okay, so if you're using that, you've got to dump out your iodine, scrub it out really well, and then refill it for the next one. So people think, well, bacteria can't grow in iodine. Oh, yeah, it can grow in iodine really well. I cultured it because I was getting a bunch of umbilical abscesses in this herd, and I cultured this, and I got salmonella out of it, and I got E. coli out of it. I got Clostridium out of it, growing in the iodine. Because every time it went on, more bacteria dropped in. So really, we had our own colony of bacteria in the iodine thing. So I don't use them. I just don't like them unless you want to dedicate yourself to cleaning them after every calf. So instead, I will either use iodine, betadine, or just Novosan, and I put it into a syringe like this, and I just pull on the umbilicus a little bit and aim it up there, and I squirt gently and just coat the inside and then the outside. And that's all I would use, 25, 30 mils, really gentle. You don't put it in there and plunge it. You don't want it to go into the abdomen, just drench the umbilicus itself. Does that make sense? Definitely a better way to do it than the cup. Yes, yes, absolutely. Yeah, and I didn't tell you about the lambs. Yes, and that was at CSU lambing. So it was nobody's fault. Just didn't think that bacteria would grow in iodine. So with lambs, I use like a 12 mil syringe, and about 6 mils is all you need in a lamb. Yep, spray bottle is great, fantastic, because you're not touching anything with it. It's beautiful. Right. Yeah, so whenever it's handy for you is the way I say that. If you're helping them get up, just hit a couple sprays right then. If it's not, everything's going well, doing well, you could treat it within 4 or 5 hours. You'd be fine. And if everything is going perfect, then I'm not going to catch a baby to spray it. But if I have to touch the baby, it's going to get treated.
All right. One of the things that food animal medicine has been a little bit slow about adopting is animals feel pain. And one of the things that this is going to affect is these little baby calves getting up and nursing after a hard pull. You've had 3 guys pulling on your leg. Are you going to be sore? Yes. So now we're starting to think, or research has shown that actually taking these calves, these ones that had a tough birth, maybe have a sore ribs, sore legs, that are giving them some pain control is certainly something worth considering to help get them up and going faster. We talked a little bit about hypothermia. There's a couple of different ways they're going to get hypothermic. One is they're just sitting there in a cold snowbank. But the second thing is they're also wet. And you know what happens when you're wet. You get chilled really quickly. So if we can get them dry, and then we can start warming them up. So the body kind of warms up in 3 different ways. One is you shiver, all right? Tim shivered when he found out I was going to be presenting with him. It's the same thing. It's the same thing with these calves. They're down there, they're cold, so that little muscle action is. There's also something in babies and young animals called brown adipose tissue. It's kind of like brown fat. It burns really quickly, and it helps warm them up once they're born. But it only has a short lifespan. It's only there for a short period of time. The third way that we warm up is exercise, getting up and moving. And that is the best way by far. So if we want to warm these guys up, the quicker we can get them up and moving, the quicker they're going to warm up. All right? So pain control, there's nothing labeled for baby calves. I'll be honest with you from the start. So you really want to talk to your veterinarian here. Banamine has been used for years and years and years. It's only labeled to go IV, and that's the best place to give it. 1.5 cc's for one of these little guys IV. But it can also be given orally, okay? You can mix it with a little milk and mix it in and get it into their system that way. I knew a guy that once had a really bad headache, and no ibuprofen, no Tylenol, no aspirin, but he was about to die and he still had a full days of work to do, that happened to just take a little bit of Banamine out of a bottle and squirt it in the back of his mouth. That stuff's like battery acid, okay? So diluting it with something is probably a good idea. I also don't recommend doing that. Did help with the headache, though, or so I heard. Transdermal. Transdermal doesn't work when they're wet, number one. Number two, a calf's hide is too tender and too fragile. You're likely to blister them. That's why they don't use Banamine transdermal on goats. They don't use it transdermally on horses. You're gonna cause some blistering and maybe slough some skin. So going orally is probably your better way to go. Again, we're not doing this for every calf. We're just doing this for the tough pulls to try to help these guys get up a little bit quicker, help them get warmed up a little bit quicker and on the move. These are just things that you guys didn't even realize you were noticing on a calf. That's painful. But you already know how to look for pain, recognize it. Now, don't forget mama. If you've been pulling on her, she's going to be sore too. Use your transdermal there. That's a great place to do it. Then she's more likely to mother up if she's not in pain. My wife was, once she got her Demerol, she was more likely to mother up with my firstborn. All right. A couple of other treatments that we can do for these guys. This one's a new one to me. Tim told me a little bit about it. The caffeine, of all things, has been used in human medicine for 40 years in the NICUs and OB wards to help these little kids that are slow and not getting going very fast. Caffeine turns out has many beneficial properties. One, in the brain, it's actually neuroprotective. It helps it helps protect the neurons and stuff that have suffered this insult from not having enough oxygen. Number two, obviously, it's a stimulant. Helps getting them up. Number three, it helps your muscles. What did you tell me about caffeine in athletes?
The athletes are now teaching athletes, football players, whatever, to take caffeine about 30 minutes before your performance, and it's overall averaging about 5% improvement on your performance. 5% in a football game is a pretty good deal. So yeah, they're studying caffeine all the time, and so we're going, why aren't we doing that in calves? And sure enough, we're actually seeing some benefit to it. Not everyone needs caffeine, right? But the one that's droopy, the ones that's just not coming around, the ones that we're going, oh, this is a dummy calf, who knows why, but those are probably the easiest thing to give right there. Because it's already made, and one bottle per calf is about all you need. So you just give it orally.
When my grandkids drink that stuff,
Yeah. It improves the diaphragm being able to move, and the diaphragm's an important part of breathing, obviously. And then it improves heart contractility, improves the heart being able to do its thing. It's also a mild diuretic, so it helps remove fluid from the lungs. And if you got those swollen heads and stuff like that, it may help bring those down a little bit quicker. Everybody's seen the 5-hour energy drink, little shots there down at 7-Eleven and stuff like that. One of those. There's actually a product that's been licensed for cattle called Calf Perk, P-E-R-K, that you just lay on their tongue, and it's absorbed through their system that's supposed to do the same thing. We've never used it. We just got some in to try. But I want you to know that it's available, and this is something to consider for those calves that just aren't coming along the way that and you're worried about them not getting up and going. I'm going to say it's just for calves, but you don't want to overdose a lamb and have a little Sonic Hedgehog running around the jug. Pardon? Jumpstart. I'm not familiar with that one.
Yeah, it's a stimulant, but I don't think Jumpstart has caffeine in it. So it's still not a bad product. I've used Jumpstart a lot, but I don't think it has the caffeine. Yeah, you have to do it weight-wise, right? Because that's for 100 pounds.
Yeah. A new procedure, not a new procedure, it's been out for a few years on the equine side, is what's called the Madigan squeeze. You've had those dummy calves that just won't nurse. Maybe they're blind. Maybe they're just slow and stupid. There's something called the Madigan squeeze, M-A-D-I-G-A-N. Google it. But basically what you're doing is you're taking ropes around the chest in 3 different points, and you're pulling them and putting pressure on that chest. The calf will actually go down and fall asleep with it. You hold them down there for 20 minutes, and what you're doing is you're simulating that calf going through the birth canal again. There's a whole lot of things that go on inside the calf while he's going through the birth canal, not just the changes of the heart and stuff like that, but there's hormones and stuff that seem to help that brain wire. And by doing this on those dummy calves and dummy foals, many of them will reset and start up again and go to nursing within a few hours. It can be repeated a couple of 3 times. It's best if it's done within the first 2 days after birth. But take a look at that one. That one's worth considering for those calves that you're getting tired of tubing and taking care of. Are we done? Oh, we're done. Okay, if you guys need to go to the beer wagon, that's okay. We don't mind. say one for us. Once the calf's getting going, this is stuff that we recommend here in the San Luis Valley, a CC of multi-men like Travis Taylor talked to you earlier. Multi-men is really good to help us with our copper and our selenium levels. A shot of vitamin A, D, and E, 5 cc's. We feel that makes a big difference as far as preventing scours down the road, as far as helping the calf's immune system. It's not a drug against different bugs, but it does seem to stimulate the immune system. Vaccines, C&D is an absolute necessity here in the San Luis Valley. All calves should get that one. If you're going to be banding your bull calves at the same time, you can get a C&D with a tetanus associated with it. You can use an 8-way at this point instead, but we tend to go with just the Clostridiums type C&D. At our clinic, we're a little fond of one called Alpha CD. It's an oil-based, and where that becomes important is this is one that they use in the feedlots, because a feedlot's where you're going to get a lot of the C&D, and it seems to stimulate a stronger immune system response. A little bit worse about leaving knots, I'll be honest with you, but it's a good product. If you have a scour problem, you got heifers that you didn't get after, forgot to give them their scour vaccine because you didn't want to stress them, whatever, there is an oral vaccine you can give calves at birth to try to protect them against 2 types of scours, but only 2 types of scours. It doesn't protect us against cryptosporidia, it doesn't protect us against E. coli or something, but if you got a roto or coronavirus problem and you heard, this is one you can certainly give. Amen. The ideal place for a C&D antitoxin is vaccinate your cow for C&D before she has a calf. Yes, ma'am. I haven't heard about that. Okay. Is it a C&D antitoxin or? Yeah. One of the other things to consider is when a calf's born, his gut is sterile. There's no bacteria in there, and so it's just a perfect place for bad bacteria to get started. Well, what if we got a head start on it? What if we got the good bacteria in there first? And so probiotics would have a good thing to consider on these calves, these ones that are stressed, so badly stressed, and you need to take care of. No, it's usually for a calf, they recommend 5 cc's. So this will last you several calves. And, oh, wait. All right, so I'm going to let Tim put it all together for you.
Okay, real briefly. And then me and Curtis will pack up, and Lisa will be packing up. So feel free to come up and chat or whatever, just so we don't make you really late to whatever you got. So this is what it all comes down, right? Curtis put the number 1 on there because he knows it drives me batty. So everything's born, we're going to get rid of the placenta, right? The big thing about the placenta too, remember, is if they eat it and it doesn't kill them, remember, just next time you pick up one, feel what it feels like, and remember how the rumen digests, right? Our digestion is acid-based, so we can destroy things. A rumen is basic, and so that placenta is not going to dissolve in the rumen. It's going to take easily 8 to 9 to 10 months for it to rot, and it's got to actually rot out in that. And so that causes, look at how big it is, and imagine how much room that's taking up, which decreases the amount the cow can eat, which decreases milk quality and milk production. Many reasons why they shouldn't be eating it. You're going to put him in sternal recumbency like this, okay? And then we're going to assure that he's breathing. We're going to put oxygen on him. We're going to make sure we see that. We're going to pound on his chest. We're going to acupuncture him. We're going to do whatever because we need to get all those. He needs to be breathing now. So in the next one you have that's born, be it lamb or be it calf, remember the little lecture about oxygen and how important that is to life down 6 to 8 months from now. Okay, how important it is for their development. The ovary is the second most sensitive tissue to lack of oxygen. So your brain is number one, your ovary is number two. And if your ovary doesn't get oxygen right away, it's not going to develop correctly. So you got to be aware of that for breed back. We're going to treat the navel with the syringes or spray bottle. Thank you for bringing that up. And then we're going to do the administrations. Everywhere's a little bit different, but multi-min AD&E here, and that's what I did in Gunnison as well. And that's what I still do in Fort Collins. And then clostridial vaccines, and then you've got to start thinking as he's laying there, I can't be spending 2 hours doing this because the baby needs to get up and get colostrum, right? And so you need to work with that, get the cow ready for that. Pain medication, they're not going to move. Really important in goats. I mean, goats, kids are extremely sensitive to pain. I use pain control in goats more than any other species. And then don't forget the cow. I can do this in 28 seconds. So if I get to go touch a cow for anything, a dystocia or correct it or prolapse or anything like that, I treat the cow. If I'm not there and the cow's doing fine, I don't treat the cow. But in my mind, if I had to touch it or you had to touch it, you should treat the cow. So because if your arm went into the vulva, you need to treat the cow. So the things you do is any type of antibiotic you want. I tend to use LA200, okay? The next one that you need to be doing is oxytocin, okay? A cc and a half of that, 2 mils of that, because that's going to help the uterus start to contract even more and clean out a little bit. 5 cc's of luteolase in the muscle, because that's going to help actually go in and break the bond between the uterus and placenta. And so it's going to actually help prevent the retained placenta. And then my pain control is Banamine. And you can use the transdermal now because it's a cow, right? And with that, just because I touched it, that's going to help protect and get your cow back in shape. Okay. Yes. Yeah, so if it was really bad and you had to twist and cramp, you could absolutely use uteroboluses. Yep. Sometimes I will. And actually, what I prefer to do over the boluses at this point, and I'm glad you said that, is I will give them LA200, and then I will actually put 30 mils of LA200 in the uterus instead of a bolus. Okay? If I have Oxytet 100, I'll put 60 mils in there. But I tend to like this in the uterus more than a bolus, but either one would be great. Very nice. Thank you. Okay. Oh, yes, questions? Really nothing. They're both broad spectrum, so you could use either one and have the same outcome. I use chlorhexidine because I have it more than I do iodine, and I tend to spray it all over myself, and I don't look orange when I'm done with. I look blue, and it looks cool. That's about my best, but both are equivalent, so either one. Yes. Oh yeah, you have to tell that one.
All right, so we get called out, and maybe it's a uterine prolapse, maybe it's a downer cow, maybe it's a bad calving or something like that, and it's out in the middle of the North 40 or North 6,000, whatever you got. And the one thing I'll always tell an owner is put a rope on her. There is something about a veterinary truck that when it pulls through the gates, that brings any cow to life. And she's up and she's gone to the roughest, hardest part of the place, down in a slough or something like that. So I don't care if you've taken your dog out there and that dog couldn't get that cow up. I got to do my soapbox thing again, right? I don't care if you've zapped the piss out of her with a hot shot and she didn't get up. Put a rope on her and tie her down, because I guarantee when I get there, she's getting up. And I don't want to spend all day chasing her, and you don't want to see me roping, because I charge her by the loop.
Thank you guys so much for having us back. I hope you learned something. Yeah. Well, thank you guys. We're going to be packing up, so if you have another question, come on up, and we'll let you get out of here before we make you really late. We did it, man.